Hello and welcome to the channel. Medicine and you. Today, we're diving into a topic that affects nearly everyone at some point. Choosing a pain reliever. In one corner, we have Advil, and in the other, Tylenol. They might seem interchangeable, but their differences are critical, and choosing the wrong one for your body could have serious consequences. This isn't just about relieving a headache. It's just about understanding what you're putting into your body and making the safest choice for your health. Let's break it down. First, let's understand the core distinction. Advil and Tylenol are not the same. The active ingredient in Advil is ibuprofen, which is part of a class of drugs called non-steroidal anti-inflammatory drugs, or NSAIDs. Other common NSAIDs include naproxen, which is a levy, and aspirin. The active ingredient in Tylenol is acetaminophen. Acetaminophen is in a class of its own. It's a pain reliever and fever reducer, but it is not an NSAID. This fundamental difference in their drug class dictates how they work in your body and what they are best used for. Ibuprofen, being an NSAID, works by blocking enzymes that produce prostaglandins, which are substances that cause inflammation, pain, and fever. Because it directly targets inflammation, Advil is often the better choice for conditions where inflammation is the root cause of pain. Think of things like menstrual cramps, muscle sprains, arthritis, or dental pain after a procedure. It's attacking the inflammation itself. On the other hand, acetaminophen works differently. Its exact mechanism isn't fully understood, but we know it acts primarily in the central nervous system, essentially changing the way your body perceives pain. It also works on the heat-regulating center of the brain to reduce fever. Since it doesn't target inflammation at the site of injury, Tylenol is generally recommended for general aches and pains that aren't caused by inflammation, such as headaches, and for reducing the fever. It's a very effective pain and fever reducer without the anti-inflammatory properties of Advil. So the first step is to consider the type of pain you have. If you've twisted your ankle and it's swollen, or you have painful period cramps, the anti-inflammatory action of Advil might provide more effective relief. If you just have a fever or a tension headache without any inflammation, Tylenol is often a suitable and effective choice. But effectiveness is only half the story. The other, arguably more important half, is safety. This is where the real differences become crucial. Let's talk about the risks associated with Advil or ibuprofen. Because NSAIDs like ibuprofen reduce prostaglandins throughout the body, they can affect more than just pain and inflammation. Some of these prostaglandins are protective. For example, they help maintain the protective lining of your stomach and intestines. When you take an NSAID, you reduce these protective substances, which can lead to stomach irritation, heartburn, and in more serious cases, ulcers and gastrointestinal bleeding. This risk increases with higher doses, long-term use, and in older adults. Furthermore, NSAIDs can affect kidney function. They can reduce blood flow to the kidneys, which can be particularly dangerous for individuals who already have kidney disease or are dehydrated. Long-term, high-dose use of ibuprofen has been linked to chronic kidney damage. There's also a cardiovascular risk. The FDA has issued warnings that NSAIDs, with the exception of aspirin, can increase the risk of heart attack and stroke. This risk is present even with short-term use and is higher for people with existing heart disease or risk factors for it. So, if you have a history of stomach ulcers, kidney problems, or heart disease, Advil is likely not your best first choice, and you should definitely speak with your doctor. Now let's shift our focus to Tylenol, or acetaminophen. Tylenol is often perceived as the safer option because it doesn't carry the same risks of stomach bleeding or cardiovascular events as Advil. For individuals with sensitive stomachs, kidney issues, or heart conditions, acetaminophen is generally the preferred over-the-counter pain reliever. It's gentle on the stomach. However, Tylenol has its own very serious risk, and it centers on one organ, the liver. Acetaminophen is metabolized or broken down by the liver. When you take the recommended dose, your liver can process it safely. But if you take too much, the metabolic pathway becomes overwhelmed. This leads to the production of a toxic byproduct that can severely damage and even destroy liver cells. This is known as acute liver failure, and an overdose of acetaminophen is one of its leading causes. It can happen faster than you think and can be fatal. The danger is compounded by a few key factors. The first and most critical is alcohol. Drinking alcohol while taking acetaminophen significantly increases the risk of liver damage. Both substances are processed by the liver, and combining them puts an immense strain on the organ. It's strongly advised to avoid alcohol if you are taking Tylenol regularly. The second factor is accidental overdose. Acetaminophen is an ingredient in hundreds of other over-the-counter and prescription medications, from cold and flu remedies to sleep aids and prescription narcotics. It's just incredibly easy to accidentally double dip and take more than the recommended daily limit without even realizing it. This brings us to the most important safety rule for both medications: dosage. You must never exceed the recommended daily dose. For a healthy adult, the maximum daily dose for Tylenol is generally considered to be 4,000 milligrams, but many health professionals now recommend staying under 3,000 milligrams per day to be safer, especially if used for more than a few days. For Advil, the over-the-counter maximum is typically 1,200 milligrams per day. Read the label, know the strength of the pills you are taking, and keep track of your intake throughout the day. Exceeding these limits, even for a short period, is where the most severe problems begin. So how do you make the right choice for you? It's a process of personal health assessment. First, consider your underlying health conditions. If you have a history of stomach ulcers, kidney disease, heart disease, or high blood pressure, you should be very cautious with Advil and consult your doctor. Acetaminophen is likely a safer option for pain relief in these cases. Conversely, if you have any form of liver disease, like hepatitis or cirrhosis, or if you regularly consume alcohol, you need to be extremely careful with Tylenol. An NSAID like Advil might be a safer choice, provided you don't have the other risk factors we just discussed. Second, consider any other medications you are taking. If you're on blood thinners, Advil can increase the risk of bleeding. If you're taking certain blood pressure medications, Advil can reduce their effectiveness. Always check for potential drug interactions. As mentioned, be vigilant about checking the ingredients of all your medications to avoid accidentally overdosing on acetaminophen. Third, think about the duration of use. For short-term, occasional pain, either medication is generally safe for most healthy people when used as directed. But if you find yourself needing a pain reliever for more than a few days, it's a signal that you should see a doctor. Chronic use dramatically increases the risk of side effects for both drugs. Don't use over-the-counter pain relievers to mask a persistent problem. Find out the underlying cause. In summary, let's create a quick guide. Choose Advil for inflammatory pain like sprains, menstrual cramps, or arthritis, but avoid it if you have stomach, kidney, or heart issues. Choose Tylenol for general pain like headaches and for fevers, as it's easier on the stomach and heart. But avoid it if you have liver problems or drink alcohol, and be extremely careful about the total daily dose. The most important takeaway is to be an informed and active participant in your own healthcare. Read the labels carefully, understand your own health history. And when in doubt, especially if you have chronic health conditions, are pregnant, or are taking other medications, the safest and smartest move is always to consult with your doctor or pharmacist. They can provide personalized advice based on your specific health profile. Thank you for watching this guide to Advil and Tylenol. We hope this information helps you make safer, more informed decisions for your health. If you found this video helpful, please give it a thumbs up and subscribe for more evidence-based health content. Stay safe and be well.